Let's look at cold exposure as a strategy to help you with your extra weight gain, obesity, and your type 2 diabetes or your insulin resistance. Let's get into it. From the Journal of Applied Physiology, and it's a good one. So they are really doing a nice breakdown of looking at what happens when you do cold exposure as a therapeutic strategy for obesity and type 2 diabetes. Notice they say cold exposure, not specifically cold plunge, because the research is new with cold, with all these modalities. The way we're utilizing it now is really emerging. But this article is really nice. You're going to want to see this. So right here, they're telling you obesity and type 2 diabetes is not good. And there's emerging evidence that cold exposure is really helpful for this metabolic dysregulation and how your body utilizes glucose and fatty acid. They go on to say that there has been anecdotal evidence for cold use for decades, specifically cold water immersion, swimming. They even talk about people skiing, and they even talk about Korean divers. But despite the mounting anecdotal evidence, the actual physiological evidence, it's not 100% all there, but they have the beginning happening. Several factors can contribute to the metabolic responses from cold exposure. Several factors contribute to the metabolic response to cold. They're listing all the different ways you can have a cold exposure. So when you get exposed to this cold, your brown fat is activated and you have a shiver response. And the shiver response means your muscles really contract, and they are looking at that because when you look at the muscles that are recruited to shiver are going to be your larger muscles, such as your quads and your pecs. And what they can conclude in their limited research is, so investigating the daily exposure to cold, at least in lean men, because that's generally who the research is done on, they have found that the proportion of type 1 muscle fibers in the vastus lateralis muscle, which is your quads, tended to be increased because of the daily, cold exposure, and that a greater proportion of the type 1 muscle fiber was associated with a lower shivering intensity in that muscle. They are implying that the shivering causes an increase in the type 1 muscle fiber. And they're saying that because it is going to produce heat upon daily cold exposure, ensuring a greater reliance on lipid oxidation rather than a limited glycogen store. So there's going to be a greater fat burning. The growing body of evidence shows that skeletal muscle thermogenesis suggests that cold exposure serves as a promising adjunct therapeutic strategy to dissipate excess energy, aka burn calories, and improve the metabolic profile of individuals with metabolic syndrome. Improving insulin sensitivity, this is showing you it is a true treatment for metabolic disease. Hit the plus sign and follow for more wellness tips. Bye.